A few years they have been using integrated medicine, that is modern medicine integrated with Ayurveda, homeopathy and yoga to treat a very common disease. That common problem is lymphedema, and it is assumed in this country that the lymphedema is caused by filariasis. Now, of course, many of these cases are caused by filariasis, and there is a huge program now for the elimination of that particular disease. But this week we've had some of the world experts, particularly in the field of genetics, who, when they've seen these patients, have declared, the main problem here is not whether filariasis has caused this, but whether they have a genetic background which is making them susceptible to lymphedema. And I think that we will have to, in time, think about other causes of lymphedema in India, and that lymphatic filariasis is perhaps not the main cause. The main cause may in fact be something to do with the genetic background. In time, that may be very important, because to cure these patients, it's not just simply getting rid of filariasis, it's managing a much more complicated disease problem. We have to find out whether integrated medicine is resulting in their cure. Which part of this integrated medicine? Is it modern medicine with its bandaging? Is it Ayurveda with its Fanta? Or is there something else happening here which is making a contribution to the therapy of this lymphedema? From the beginning, we have said, well, let's just get the data on how well these patients are doing by coming here and having this integrated therapy. In time, we want to have such a good database that we can look at it and say which part of the treatment is really having this good effect. Modern medicine will be a little disappointed if my view is put forward that the main reason why these patients are getting better is not due to bandaging. Because, for instance, in the United Kingdom, bandaging is one of the main ways in which we manage lymphedema. If I say that what I see here is that bandaging is effective all the time they are in this building, but when they go home, it is such a difficult technique that it is neither compressing nor is it containing, and therefore I have some doubts in the long term whether bandaging, which is the most expensive part of the treatment, is actually playing any important role in containing the lymphedema. So far as the Fanta and the yoga, these are the truly locally available therapies. And the term locally available is a very important one, because a treatment which is locally available at low cost, proven over thousands of years to be safe, is a very desirable treatment. And I hope that in time we will be able to show that both yoga and the use of Fanta is a major reason why these people are getting better. It is what the government of the World Health Organization believes, self-adaptation. These patients are taking over the management of their lymphedema, and at home, often in rural areas, they are able to get at low cost their local herbals and their culturally acceptable exercise, which is yoga. I believe that something else is happening here, and I look forward to being able to prove this, and that is the patients come here fearful and unhappy, but they leave here no longer fearing, very hopeful, and often happy. And this, in terms of effects on a pathology, is very important, because being happy and being hopeful is much more therapeutic than being sad and fearful. I think that this institute is providing integrated medicine, which includes Ayurveda, Yoga, and modern medicine, but it is providing something else, which is patient participation and patient self-adaptation. The patients are taking over the management with confidence, but they're also participating and fighting this problem, not just here and at home, but joining together in groups to advertise the slogan that this disease is manageable, and that this institute cares for them not only here, but when they get home. You should not fear filaria. And filaria is going to be eliminated. But there will still be lymphedema in India for many other reasons. And to have a system which can control and improve the lymphedema, whether or not there is filaria, is important. And there will be many cases, due to their genetic background, and other causes. In England it's cancer, but there are many other reasons. We find worldwide that the increasingly elderly population, they all have swollen legs, much more commonly. And this is part of the business of a frail elderly generation. And this will happen in India also. So we're going to continue to have swollen legs. And it won't be due to filaria, it'll be to all sorts of other reasons. And the treatment here that is provided will manage all causes. One of the battles that has to be won is within the medical profession, because lymphatic diseases are neglected. And as I said in one of my talks, you can look into thousands of books about medicine, and they will not mention the lymphatic. And therefore we have to ask, why do you not know about the lymphatic? And then we have to say, we now have the evidence. Almost daily there are publications pointing out that the lymphatic has a very important function, and that it contributes both to our immune system and how we control inflammation, how we control cancer. We have to know much more about the lymphatic, and no longer should doctors from modern medicine neglect the role that the lymphatic is playing. When we talk about integrated medicine, the modern doctor has to realize that we are getting proof of good effects by adding traditional, complementary, and alternate medicines to modern medicine. But we have to do it in a scientific way, and we are doing that in the Institute of Applied Dermatology. In order to do this, those who are practicing in the Institute of Applied Dermatology are giving most of their time to treating patients with a severe disability. But they also have to influence governments locally, nationally, and internationally to see that this is a very common problem which has to be managed much better. And they will need to use all their data to prove this point, because without the support of governance, that is local government, national government, and international government, we cannot have the political and economic benefits that are given to major disease problems. We need more money, and we need more political support.